So good morning, everybody. I'm so happy to be here. And yes, I did bring my Chiefs lanyard just to irritate Jonathan. I pulled it out of my purse and went like this. Today, we're going to be focused on the 40th anniversary of the first crisis teams, school-based crisis teams in the country. And I really meant for this not to be so much as giving you information, but as an opportunity to really reflect your work in schools. Because as we know, schools are RAND Corporation, the think tank that provides a lot of guidance for national policy, did a big study in the late 80s, and the outcomes of that study have not changed, which is there are thousands of children, thousands and thousands, 85% of children do not get the mental health services that they need. It's delayed by several years because of the lack of available, accessible services. And if they do get mental health services, they get it in schools. And I will share with you some of the studies that my colleagues and I have done over the years in my first real job at LA Unified School District, which is still the second largest school district in the country. And you know, it's not meant to say do what we do. It's meant to say reflect on where you're at, because we're all starting anew. We're at another beginning point, because those of us who began when the dinosaurs walked the earth are now, exiting stage right, one at a time, as we reach another developmental stage. So let me just start, because I want to bring you into my culture. Aloha, everybody. How many of you have been to Oahu or Maui, or how many? Yes, good. Well, aloha, we hope you come back again. I love meeting people. That's one of the things about Hawaii that is very special, is that there are literally millions of people who come onto the islands every year, and you run into them, and it's always fun to say, where are you from, and what are you doing, what are you looking at, etc., and telling them, oh, you got to go to the shrimp trucks on the North Shore, where the shrimp farms are, because they take the shrimps fresh out and they saute them for you in butter and garlic. Like, what could be wrong about that? So truly, there is everybody welcome. It is a different culture altogether. When I lived in LA for over 50 years, I was very used to being like having, driver's Tourette's, the words that would come out of my mouth on the freeway. And we use different fingers, not the shaka, but we use different fingers in LA on the freeway. And when we talk about diversity, it's very different, because over 50% of the people in Hawaii are mixed race. So my son-in-law, I used to call him Chop Suey until somebody made me stop. But he's Chinese, Japanese, Hawaiian, German, and Portuguese, all in one. And his great-great-great-grandfather, who started our family, was a paniolo, a cowboy from Portugal, who came to teach the Hawaiians how to raise cattle on the Big Island. And as one of the ancestors, he's buried in one of the sacred caves on the Big Island. I just want to say, oh yeah, so somebody said, stop calling your son-in-law like Chop Suey. He's a Hawaiian dog. That's what they mean when it's all mixed up. Okay, the other thing is, when you come to Hawaii, forget your diet, because we eat junk in Hawaii. There's nothing that people will not fry in Hawaii, okay? And despite all of that, when I was living there, did you know that the people who have the greatest longevity are on Hawaii? And we do not eat lettuce. And the reason for that is because we don't stress out about anything. It's at the top level, it's at the bottom level. Take your time, shaka. You're going slow. It's okay. They come around, they go, shaka. And when I go into the grocery store, they don't call me Dr. Wong. They call me Auntie. Auntie, what are you looking for? I want some fried wontons. Okay, come on, Auntie. He walks me over there. It's a big display. I said, okay, I take this one. He says, okay. We go in the line. I'm almost ready to pay. Auntie, I found another one. It was in a different part. Do you want this one? Okay. It's truly a culture where children, the keiki, and the kupuna, the older people, are truly respected. So when you go, and if you were born before 1990, I won't make eye contact with you, but if you go and they call you auntie, it means they feel like you're a part of the island. You're part of the ohana, the family. So, the other thing is, like, we don't care what size people are. Once I was going, they was like, I can't eat that. I was at a party, there was like prime rib, spaghetti, somebody brought duck, it's like a big international buffet. I said, I can't eat that. I said, I'm not gonna, I'm a big size already. And the woman who was a very sweet Samoan lady, who had, her neck was like as big as one of my thighs, she said to me, there's no size in Hawaii, there's only happy size. So what size ever you are, you're a happy size, And also, as part of the culture, if you don't feel good, find something to eat. It'll make you feel better. And lastly, in case you think we're completely disconnected from the mainland, which we often feel like sometimes, Hawaii is composed of 8 islands. And there is a 9th island because Hawaiians love it so much. Love it. And that's Las Vegas. So there's actually a show that's called The 9th Island, and every week it tells you like what new thing to do in Las Vegas. So that's my culture. I hope you will be there. I hope you will come and visit, and I promise you we'll treat you right. So let's start out with the presentation about, crisis teams and how they came about, at least in LA Unified 40 years ago. And that is that everything we know about PTSD comes from war, that the history of child trauma is not very old. It goes back to about 1984, but it really wasn't solidified till the late 1980s. And in terms of ACEs, that study was done between 1995 and 1997. So it's still in its youth. And remember that ACEs was a study done entirely with upper middle class Caucasians in La Jolla, California. That's north of San Diego, very high rent, never stayed there, hotels too expensive. But it was done with upper middle class Caucasian people, and it was never done originally with any people of color, nor with children of color. And it was a retrospective study. So it was, here you are with this heart disease, cancer, diabetes, possibly obesity, all sorts of chronic disorders, health disorders. Let's go back and see, did you have any adverse childhood experiences? And that's how Dr. Felitti and Dr. DeAnda came up with the 10 early adverse childhood experiences. So there is lots of research to be done. And I know that this is really a conference where so many researchers who we look to, in a sense, to tell us how can we apply what they have discovered in their studies and apply it to the way that we practice today. So let's go on. I just wanted to show a brief little slide about what was considered post-traumatic disorder over time, and that it really reflected the science, the thinking of the time, because we didn't always call it PTSD, although amazingly, the symptoms are exactly the same. So not even going back to prehistoric meaning before records were ever written, there were oral stories from the Peloponnesian Wars, the Greek Wars, etc., Spartan Wars. They described many of the soldiers had the warriors had these symptoms of PTSD. But in the Civil War, when people, most men who survive, because even minor injuries, or let's just say an injury to the arm, might turn in ultimately to death because of sepsis. There wasn't any medical care. You know, they might have just amputated your arm or your leg on the battlefield. So if you survived and you went home and you had these symptoms, they called it soldier's heart, because they were disconnected from their family members. They couldn't resume loving relationships with their family, or perhaps even with loved ones, perhaps a fiance that they had had prior to going to war. In World War I, it was known as shell shock because it was considered a neurological disorder, that so many shells exploded around the soldiers in World War I that their neurological systems were damaged to the extent that they had these particular symptoms. And we get to World War II, and it's called wartime neurosis. And whose influence was that? Neuroses. Who talked about neuroses? That's right, Freud. So he was wrong then. Sorry, he was brilliant, but wrong. And it wasn't until the Vietnam War that the Veterans Administration commissioned the first studies, and it was called PTSD. So at that time, how did this apply to everyday people? I mean, wasn't it just soldiers who had PTSD? The group that recognized that these symptoms were a part of quote unquote normal populations, non-war combatants, were rape clinics and victims of crime. And they realized that women who had been sexually assaulted had very much the same kinds of symptoms and were suffering greatly and needed treatment and support and acknowledgement. And, to the extent where at least it began the conversation that victims should not be blamed. And we still, unfortunately, need to have that conversation today. In terms of intensity, over 35% in some studies indicate that those soldiers, men and women who had multiple deployments, have high levels of PTSD and need both medication as well as psychotherapeutic services. So we're moving now into a quote unquote normal population. Some of you may remember the Chowchilla bus kidnapping, where children who were on the way home in Central California, in farm country, they were coming home from summer school. They were in a bus, and two young men kidnapped the bus and everyone in it, and drove the bus to a nearby stone quarry, not so nearby, about an hour away. And they drove the bus down into a pit that had been dug and then covered it with cardboard that they had brought to the scene. And their idea was that they were going to ask for $1 million, a lot of money back then, for people to come and they would tell them where the children were. Well, they never told anybody. And they left the children there. And if it weren't for the bravery of the high school students that were in that bus and the bus driver, they saw that the children were fainting, because I don't know, those of you who've been to Central California, it's over 100 degrees there in the summertime. And they said, look at the kids. We've run out of water, we have no food, and they're going to die. So they came up with a plan, and they told the kids, we're going to go first. We're going to push up the top, so a little entry point at the top of the bus, and we're going to run that way. And they're going to shoot at us and possibly kill us, but you don't worry about that. You go the other way. So that's what their plan was. They pushed up the cardboard off the top. The adults, older children and the adults, ran one way, and the kids came out, climbed out, and ran the other, and there was no one to be found. So the book that talks about this was written by Dr. Lenore Terr, who's from UCSF. If you ever are interested in a historical kind of a look at what, in 1976 is when her book was published, what PTSD looked like and what she was talking about, that's a great book to read. The sad part of it was she was almost drummed out of psychiatric associations because not everybody believed her. She said, look at these kids. They're doing everything the adults ask. In fact, they're so quiet. You tell them go to this room, they go into that room. You tell them lie down on the bed, they lie down on the bed. You say go out and play, they just sit quietly together. And she said, every one of these children have PTSD and it will be life-changing for them. And they said, you're crazy. You're a psychiatrist, but you're wrong. And she went back over time, you know, a good researcher, chronologically followed up on these kids, how are they doing, only to find out that in adulthood, the children said, we have PTSD, we think about it every day. And that what happened during that time was they were so terrified that they couldn't speak. And so she called her book, Too Scared to Cry. One of the first books about a real situation and with respect to children's PTSD. Now, the reason why I say it's the 40th anniversary is that 40 years ago, I responded to one of the first school shootings in the country in LA, at the Los Angeles Unified School District. And people don't realize that, you know, sometimes weird stuff happens in LA and they think, LA. I'm sure that you, if you're in Miami, that strange stuff happens, they go, Miami. And they thought it was just a one-off thing. And we hoped it was. But what happened was on a February afternoon, as the children were coming out of school, 1984, no safe school plan. Why would a school need a safe school plan? You know, schools are safe places. I remember the chief of police of LA Unified School District saying, it's an oasis of safety in a community of chaos. 49th Street School, kids are coming out from classes, playing on the playground, some of them getting ready to leave, and the man has a whole cache of weapons, and he starts shooting at the kids from his second floor apartment building. And he's shooting at them, and he's wounding them, and he kills 2 of them. And he's shooting, and as the teachers came out, they thought it was firecrackers. So they came out, they grabbed as many kids as they could, they pushed them into the classroom, the administrators ran out, they were shot. They tried to drag as many kids out. Please run, kids, run back inside. It taught us in the aftermath of that, because we did so many things wrong, sometimes you learn a lot when you do stuff wrong, is that, you know, we re-traumatized those children. One of the ways we did that was that it's Los Angeles, right? One of the media capitals of the world. So people from all over the world, some not even speaking English, came and said, well, we want to interview the children. We want to interview the parents because this has never happened anywhere before. And we said, oh, okay. We re-traumatized all the children and the parents. And we learned you've got to protect them. We have to, protection is one of the main, you know, steps that we have to take when someone has been traumatized, because safety is everything. From that, we developed the first district level crisis team in the United States, and LA Unified at that time was 750,000 children, K-12, and 1,000 schools and offices. And it was because of one of our superintendents who said, this is going to happen again, and we need to be ready to prevent this on one hand, and on the other hand, to respond as quickly as we can to minimize the hurt, the injury, both emotional and physical, to the students. His name was Dr. Sid Thompson. He's like one of my heroes for making that stand at a time when nobody, I don't know how many superintendents would have said, yes, we need a district level crisis team. So neuroscience and research, I mentioned the first really research that was done was the ACEs study in regard to adverse childhood experiences and the possibility that children come to school already with a baseline of a trauma history. So one of the things that needs to be altered is when we go in and do an assessment after a crisis, a mass violence event, a gunshot, a gun, event in a school, how many of those children have already had that kind of experience in the home, in the community? And I'll tell you about a study. Well, I'm just going to say it now so that when I come across, I can just click it off. Is that my colleagues and I at RAND did a study of the entire LA Unified School District, 11-year-olds, and there were 33,000 of them. And we got into their hands a survey that said, have you been hit, kicked, punched, or threatened with a gun or knife in the last 12 months? They mapped out 700 square miles, because, Grand can do statistics. And they discovered that not all of LA Unified, like all of your districts in Broward County, are the same. In fact, there are some areas, some zip codes where exposure to violence is much more common than we realize. So as we move forward, I'm going to talk a little bit about what about a public health approach? How can we incorporate that into the way that we work in schools? And more schools are reaching out into the community and saying, we need your expertise to be a part of our crisis teams. We need you, your experience, your clinical knowledge, your skills to help us to get our kids back on track. So we try to incorporate neuroscience into our work, and we had, I'm just going to invoke his name because he's another hero, is Dr. Bruce Perry, who came to USC and talked to us about, what is it that we're doing that really helps the brain to move from the base, from the survival brain to the thinking brain, the prefrontal cortex, because that's where kids are stuck. And teachers too, when there's an act of violence on campus, it's part of our human evolutionary, genetic history. And on my mind, I wasn't going to talk about this when I was asked to be here, but I did respond to Lahaina, to the fire in Lahaina. How many of you have been to Lahaina, to Maui? One of the most beautiful places on earth. And the scar on the side of that hill is heartbreaking, because Lahaina was not just a tourist spot, it was the ancestral home of Hawaiian royalty. And so there were it had a lot of historical meaning. And the other thing that it had in common with Oklahoma City is it had a living tree that was over 100 years old. It was the banyan tree, and it burned. But miraculously, just like in Oklahoma City, parts of it returned, and it's growing again. And it is a sign, a symbol of hope, that in nature, it isn't always a period on the end of the disaster sentence. So in general, recently the National Center for School Mental Health cooperated with some other researchers, and it's amazing that we haven't made that much progress since the late 1980s, and that is that 85% of children receive no services, and that at that time, just a couple of years ago, there's a 10-year delay from the time that we identify a child, and it could be in kindergarten, it could be in first grade, second grade, there's a 10-year delay before children get into a system. The remaining 15%, they all get it from schools. And we have studies that we'll get to demonstrate that. That these studies were done by my colleagues at RAND, and also by Dr. Tony Manarino, Dr. Cohen, who are the originators of TFCBT. So some of you know what that is. Excuse me. Well, we know that violence, an experience with violence, and that disaster survival, especially where in Los Angeles, in the Palisades, in Altadena, the Eaton fire, 16,000 homes were burned down. 16,000. It's like Lahaina times 10,000. It's huge. That most people pull together and function during and right after a disaster. But gradually over time, their coping may erode because there's so many challenges ahead. I know you're filming this, but I just want to tell you this story. It's so bad. So in New Orleans, after Katrina, how many of you have been to New Orleans? You know those T-shirt places that have all those nasty T-shirts? Love those places. So they had one, and it was like FEMA, right? Federal Emergency Management Agency. But that's not what New Orleans said it meant. New Orleans said it meant fix everything my ass. Because the challenges of rebuilding were so great and the paperwork, it was like, no, you think this is gonna, New Orleans strong, LA strong. No, wait, yeah, we are, but there's a big road ahead. So in Lahaina, it's been over a year. They finally cleaned up that one strip of toxic waste, and now they're in a fight because they want to dump it somewhere on Maui. People in Maui are going, not in my backyard. They say, and they can't dump it in the ocean. Can you imagine dumping toxic waste into the beautiful waters around Maui? So think about that. There weren't that many houses in Lahaina. They just cleaned it up. It took them over a year. And now it's just sitting there because no one will take the toxic waste. What are they going to do in LA with 16,000 houses? The toxic waste from I don't know how many thousands and thousands of acres. And already they've started to say, not in my backyard, because they're going here and there. Can we dump this toxic waste in your backyard? One of the things they're doing is they're saying they're testing the air. Okay, test the air. How about testing the groundwater once you put it in there? How about testing all the dirt around it? How about testing the ocean? Because, some of that stuff flows down to the sea. We've got a lot of challenges ahead. And so no one who sees a disaster is untouched by it. Even though we may have survived the fire, there are other secondary adversities that occur, just like hurricanes. I admire you folks so much. You have a hurricane season, okay? I'd rather take my chances with an earthquake. I'll surf an earthquake anytime. It's just, but there's no season. And here's the other part of it: as mental health folks, people who've gone through a disaster or mass violence event, they don't see themselves as needing mental health services until they do. And at that point, it's what Harvard calls toxic stress. Because it's not just one thing. It's not just the hurricane or the earthquake or the fire. It's all the stuff that comes after that. It's piled one on top of another. It's cumulative to the point at which it becomes toxic to the individual because they begin to think, I can't do this. I'm not good enough. I did something wrong. I want to give up. So that's what our job is. How do we reduce levels of toxic stress and create programs and services that help just unload that a little bit, right? I'm a big fan of Downton Abbey, sorry. And there's some point, they say all these really wonderful things like, a problem shared is a problem halved, cut in half. But Harvard said the same thing, so it's better to think about Harvard than, not looking for mental health advice in Downton Abbey. So what we also know is that adults aren't always paying attention to their kids because they can't. If your house is gone, you're dealing with insurance, you're dealing with FEMA, you're dealing with when's this toxic waste gonna, be done? And is FEMA really gonna be eliminated? Is this the time for FEMA to be eliminated? That's tough. So how do we help people balance optimism, because that's really needed, with realistic challenges? Yes, you can do it, but just take it one step at a time. That's what resilience is about, one step at a time, every day. And as I learned from my colleague, Lisa Wilby-Veach, she's here today to join me in the workshop in the afternoon around threat assessment. I learned so much from her because she's in a pioneering position in Parkland. She's the liaison for the families whose children were murdered in MSD high school, and the liaison for families whose children were seriously injured by gunfire. And she has done this job for 7 years. She's walked down the path with them and seen what are the secondary adversities, the trials, the big trial, the trial of the SRO officer. And I'm not saying this to be critical, I'm just telling you what's in the record is that he sat outside for 42 minutes while children are being killed. He was found innocent. So that also just was very disturbing to the parents. Recovery is not linear. In fact, the parents will never use the word recovery because, I never recover. My beautiful 14-year-old daughter, Gina, was one of the first people killed. That's what Tony Manarino and Jen, his wife, would say, and I'll never recover from that. Or, Max will say, my son, Alex, he was so handsome. He was a young band member. He was so popular at school. He wrote, poetry. He shared some of the things that he wrote. And he was murdered for no reason. For no reason. He was one of the innocent. Don't even know if he knew the guy that the perpetrator. And one of the things they taught me is never say the perpetrator's name. Never. Talk about Gina, talk about Alex, talk about Max, talk about Tony, but never say his name. So, phases of disaster, those of you who were born before 1984, again, I'm not making eye contact with you, but this is a diagram that came from 1984, and it's from SAMHSA, Substance Abuse Mental Health Services, from the U.S. Department of Health and Human Services. And I like to use this because there's changes that we probably should make to it, but it was really quite amazing that they put it together. There weren't that many disasters in 1984. My colleague and I from UC San Diego wrote an article about the increasing number and intensity of both fire events, water events, and climate events that are affecting the world, and how there are now millions of climate refugees who can no longer live in their homes and had to move because of these large-scale disasters that are now linked to climate change. Okay, start at the beginning. You can think about whatever disaster you've been through. It could be a school shooting, could be man-made, that's what we call it, school shootings. Man-made disasters, could be natural disasters, could be hurricanes, could be some from another place. There's a warning. 9/11, there was a warning. They bombed one of the towers before. It wasn't like all of a sudden, no, it happened before. And to some extent, we either pay attention to it or we don't. But the idea is that the threat is there, and then all of a sudden, it happens. So you might have thought that it was coming up the coast to Miami towards Sarasota. Then it turned toward Orlando, and then it went up the coast along the Atlantic. You never know, right? And it hits your town. It hits your community. And you see where it says event, I would say that's one of the big changes. You go all the way down to the bottom because it completely devastates people. They live at what I call the base of Maslow's, the base of Maslow's priority list. And Maslow's priority list needs to change. It needs to add mental health support. It's essential. It's as essential as food and water, because if you're there with your kids, their dog burned up in the fire, I know. If my son's dog, who is my grandchild, burned up in a fire, I would be devastated. Devastated. Okay, so it happens, and a heroic period starts right away. How much money do I have in my bank account? Can I support this GoFundMe? Who do I know? Let me contact them. Let me see how they're doing. Let me share how much I care about them. Let me ask what do they need. And 9/11, it was all the people who lined up along the streets as the recovery workers walked down from the pit, which is what they called the area where the Twin Towers collapsed. And some of them brought food, dry socks, clean clothes, a sweater. And the other people who noticed, like, oh my God, I didn't bring anything, took off their socks, took off their sweaters and gave them to the rescue workers. It's a honeymoon period. People will literally give the shirt off their backs. And it lasts for a long time. It's very heroic. You join the heroes, and you're a hero yourself because you're willing to give of your substance, whatever you have, everything. And then it reaches a point, and this can be 2 weeks, 3 weeks, a month, or it can be a nanosecond. So in New Orleans, it was a nanosecond because people were in the Superdome. There was no water, there was no food, the toilets were overflowing, they were being attacked, young women were being raped, and they called, I'm not talking out of school, okay, this is in the newspaper, on the media, that they called the head of FEMA. He had just been appointed, right? He had just been appointed. They didn't know who he was. They called his office, and the secretary says, oh no, I cannot interrupt him. He's been waiting for this reservation at this very high-end restaurant for 6 months, and he's there now. I'm not calling him. Come to find out, his background was not in emergency services. He raised Arabian show horses. Look at who gets appointed to these. It might be a political reward, but it's no reward to the people who need them. Okay, that's all part of the disillusionment period. And it takes like a piece at a time. We just learn things that's like, why in, another one, it's happening right now, why in Altadena, which is north of Pasadena, in a historically Black upper middle class neighborhood, was one side that was closer to the Pasadena side. Why were they notified to evacuate at 5:30 in the afternoon? Excuse me, but the other side was not warned until 2:30 in the morning. And they warned them by driving police cars saying, you need to leave now. At 2:30 in the morning, I'm comatose. I'm asleep. And so many people on that side of Altadena died. In fact, more on that side died than on the side that had hours earlier their evacuation notice. And it's human error, because in Lahaina, they said, why didn't you warn people that this fire was sweeping down the hill? These grasses that they were invasive, non-native grasses that had been brought to the island, and it was sweeping down the hill. Why didn't you warn them? Because we have an extensive warning system. If you go to Hawaii and it's around the 1st of the month and you're outside, that siren will be so loud, it will just scare. I almost dropped to my feet when I heard it. It's like, what is this? It was originally there, goes back to tsunami warnings in Hawaii, okay? So they were just practicing, and when you hear it, it's so loud, it just scares the heck out of you. So why didn't he in Maui turn on the warning system? And he said, because the fire already started, so I figured, hey, they're looking at it. We've had in Hawaii, it's paradise, it's true, but we do have our challenges, okay? The warning system is now being used in case the fellow in North Korea who's been building these oceanic projectile rockets can now reach Hawaii. It can reach Pearl Harbor. He's trying to get it to reach the West Coast. So he keeps practicing, right? And we did have a warning that said, you know, it's coming. It was a false alarm. But we all looked at each other and said, what are we going to do? What do they say? Hold your behind and kiss everybody goodbye? There's no place to go. You don't know where the rocket's going to land. Nevertheless, it was blaring, the siren outside. So what do we do? What do we do about that? How do we make it better? This disillusionment period can last a long time, but at the same time, we're working through to a new normal. And what are those steps? And that's where we really need in schools for mental health folks to be there to provide psychological first aid to our students and to the parents who's lost everything. Because Lisa will tell you, after 7 years, I said, Lisa, how often do you use psychological first aid? Twice a month now? It's coming up 7 years. Once a week, once every 2 months? And she said, every day. Because there's some point, some reaction that a parent might have, or their sibling, the children who survived their sibling's murder, who are trying to struggle with making meaning out of yet another school shooting. Here's what we call disaster despair. And Maslow's hierarchy we should get together and just change it, put all our names on it, just sign at least like the Declaration of Independence to be the declaration of the new hierarchy for survival. And one of the things I want to emphasize is crisis of faith. And that happened in the fires, and it happened in 9/11. We were asked to go, with the Department of Ed, we were asked to go to speak with the Archdiocese schools of New York City. And I asked the counselors in those schools, what is the most difficult thing that you have to deal with? And they said, look, these kids go to chapel twice a week. They pray every day in class. They have activities on Saturday. They go to church. They're like, their mothers are in the altar guild. They're altar boys and girls. And their question is, why would God let this happen to us? We're good people. So we need to include our faith partners in that. Are there effects on schools? Absolutely, and this is why we need you. The effects of violence and trauma, they take a toll. These are the studies. They're over 20 years. I've just changed the dates because new studies keep coming up and confirming that there's a loss of reading ability in children in elementary school who have been affected by disaster and violence. There are decreased rates of high school graduation. There's lower grade point average. There's more suspensions and expulsions, and there's more absence from schools. And behavior for children has meaning. They may not be able to say it with their words, but they say it with their behavior. Now, I showed this. I was asked to open the schools, to do a keynote for the schools in Pasadena Unified, and I put up these 4 pictures, and I asked the participants, can you tell me which one is Gaza? Which one is Lahaina? Which one is Pacific Palisades? And which one is Altadena? It's challenging. You can kind of sort it out. There are not that many cars left in Gaza, but and there weren't necessarily tall buildings in Altadena. Oh, and I just wanted to make it relevant to you all here in Florida, where you are challenged, like which one is Ian? Hurricane Ian, which one is Irma? Which one is Michael? Which one is Francis? It's hard to tell, but if you've lived it, you probably can because you've seen these pictures before. One thing I have to say is that we did studies about the initial aftermath, and certainly we were all dealing with trauma, but about the 6-month mark, trauma turned into depression. So if you're helping a school, think about like what stage might they be in? Are they in the fifth place where they had to move to live? Has the father gotten a job yet? Have they gotten their car back? Are they in a stable housing situation? Are they able to get food? Okay, last one, I'm sorry. Here's the rationale for schools and why schools are important as places of service. So Tony Manarino and Dr. Cohen, who are the creators of TFCBT, and Dr. Lisa Jaycox, who's from RAND, and my colleague who's one of the developers of CBITS, Cognitive Behavioral Intervention for Schools, for trauma in schools, 120 kids after Katrina in New Orleans. 60 were randomized to TFCBT, 60 were randomized to CBITS. Now, all of our interventions are for schools. So it takes place in a school. TFCBT is a clinical intervention. Both have met the gold standard, randomized clinical trials. They are effective. There's no question that they are both effective. But here's the outcomes of this. The 60 who went to CBITS in schools, 56 of them completed all 10 sessions. Of those who were TFCBT, had to go to a clinic, only 4 completed. People don't have the wherewithal to get into a car or a bus and drive to a clinic. Clinic is not a natural habitat of children. Schools are the natural habitat of children. So I want to thank you for all you do, and I hope that you will be co-located in schools because we need you desperately. Your experience, your knowledge, your skills, and most of all, your kindness and love. Thank you so much.
So I wanted to ask because I saw it in one of your presentation slides. You mentioned a couple times about like school shootings. That was pretty impactful for the victims. I wanted to know if you've done any research or know of any research about those impacts that those victims had. Anything from like previous years or recent years, and if there's any differences among that time.
Lisa, do you have a response? I mean, you've been working with families for the last 7 years. Let me just do a preface to that. Is that in 19, oh my God, in 2020, the National Center for Education Statistics said they reached a high of violence events in schools, and 77% of all schools had at least one violent event in schools. We're living in a culture of violence. And it's not that every school lives it every day, but that it's actually quite a common occurrence. So you were asking though about the aftermath of a school shooting, is that correct?
Yeah, like how should I say this? Like the psychology, like the victims, like going through PTSD, like processing that.
I see, the time that it takes. Okay, so there's only one study that comes even close to that. And that's the study that was done after 9/11 in New York City about how over 3,000 people died. And they did a survey of the children. And they found that in the aftermath, there was 26% of all the children in New York City schools had a mental health disorder that required treatment at the clinical level. How long does it take? Well, it depends. If you have interventions, it should be tiered. Like, are you providing everybody with a universal intervention like psychological first aid? Because that helps with the majority of people. And if they get that, they might not need the higher level for treatment of PTSD. I don't think there's been a study in Parkland that shows kind of the trajectory of either the prevalence of PTSD or the time length of treatment. But if you could go through these evidence-based interventions, they will say that it takes about 4 months for treatment, and if you're using one of these evidence-based interventions, they should drop right out of the clinical range. They've been shown to be proved effective, including TFCBT. So that's what you're looking at if the children have access to it, and if the people who are providing it are trained. So here's one of the things that I think is really important about all of us getting on the same page is in San Bernardino, I was called by the survivors of the terrorist attack there. You know, they were in a birthday party and at a, I think what was that kind of, a developmental, child developmental center. And the terrorist came in and he went in a small room, shot them. Some of them, I talked with them, one of them was holding a friend, and he looked at her and he shot the friend in the head and walked on and continued to shoot other people. And she was referred by the county of San Bernardino to their employee assistance program. And one of them, they went, and the therapist said, "You have to start talking because I can't handle it anymore." Another therapist started crying. She couldn't stop and had to be comforted by the person who survived the terrorist attack. A third one said, this was the best. The therapist said, "I haven't been trained in this, but I want to be with you. I want to try. We'll try together." So are we ready? I don't know. I think different places would say we are and we aren't. So how do we get on the same page about being ready today? Because I can't believe that there isn't going to be more happening in this political environment where we don't know if there's going to be FEMA or the Department of Education, where every grant is scrubbed of DEI citations. I don't know. But anyway, that's a great question. But if it's an evidence-based intervention for as many sessions as is required by that intervention, if it's gone through randomized clinical trial, that's how long it takes to heal PTSD. Thank you.